Dear viewers, this is part 1 of the 3-part series on transplantation in the Medicine for Anyone in the YouTube channel. Transplantation. The present scenario. Organ transplantation is one of the great advances in modern medicine. Unfortunately, the need for organ donors is much greater than the number of people who actually donate. Every day in the United States, 21 people die waiting for an organ, and more than 107,380 men, women, and children await life saving organ transplants. Donor organ supply. The shortage of donor organs represents the most challenging global problem. Although the number of transplants during the last 3 decades increased twofold, the number of patients on waiting lists increased sixfold. The demand for donor organs by far exceeds the supply. Major contributing factor to the organ shortage is impaired donor tissue quality due to the aging of the population and pre-existing diseases such as non-alcoholic steatohepatitis, that is NASH. This NASH, that is non-alcoholic steatohepatitis, is inflammation of the liver caused by excess fat cells in it, that is earlier known as fatty liver disease. Chronic inflammation causes progressive liver damage. NASH resembles hepatitis caused by alcohol use. These suboptimal, that is less than ideal grafts, are particularly susceptible to ischemia reperfusion injury, that is IRI, that is reintroducing blood supply after a period of absence of circulating blood within the organ. As many as 4,994 discards, that is the number of harvested organs from donors but later rejected, were never transplanted due to inferior quality in the US alone in 2018. Dear listeners, by the way, this educational video is made possible by PrescribeOn, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribeon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. The problem of self and non-self. The immune system of the human body has evolved to protect the individual from invasion by pathogenic microorganisms as well as malignant or pre-malignant mutation of the individual's own cells. Hence, stringent discrimination of self from non-self or altered self is crucial to ensure immunological responses are directed correctly and to limit damage to self tissues that might otherwise occur during the response to a foreign pathogen. To complicate matters, the immune system is continually exposed to new antigens. Many of these are harmless or even beneficial, for example, bacteria composing the intestinal flora. Hence, the immune response generated must be proportional to the threat that each new antigen indicates. Most of the different antigens of the RBCs that cause transfusion reactions are also widely present in other cells of the body, and each bodily tissue has its own additional complement of antigens. Consequently, foreign cells transplanted anywhere into the body of a recipient can produce an immune reaction. In other words, most recipients are just as able to resist invasion by foreign tissue cells as to resist invasion by foreign bacteria or RBCs. Autografts, isografts, allografts, and xenografts. Autograft. A transplant of a tissue or whole organ from one part of the same person to another part of that person is called an autograft. Example, skin grafts in patients with burns. 2. Vascular grafts for coronary artery disease. A coronary artery bypass graft, CABG, is a surgical procedure used to treat coronary artery disease. It diverts blood around narrowed or clogged parts of the major arteries to improve blood flow and oxygen supply to the heart. 3. Vascular grafts for peripheral vascular disease in the limbs. Isograft from one identical twin to another is called an isograft. Tissue transplanted between genetically identical members of the same species. Example, grafts between monozygotic twins. Note, monozygotic twins, that is identical twins, result from the fertilization of a single egg by a single sperm, with the fertilized egg then splitting into two. Identical twins share the same genomes and are always of the same sex. Allograft from one person to another, an allograft. Tissue transplanted between genetically different, that is allogenic, members of the same species. Example, grafts between unrelated humans. Xenograft from an animal to a human is a xenograft. Tissue transplanted between individuals of different species. Example, pig to humans. Transplantation of cellular tissues. In the case of autografts and isografts, cells in the transplant contain virtually the same types of antigens as in the tissues of the recipient and will almost always continue to live normally and indefinitely if an adequate blood supply is provided. At the other extreme, immune reactions almost always occur in xenografts, causing death of the cells in the graft within 1 day to 5 weeks after transplantation, unless some specific therapy is used to prevent the immune reactions. Some of the different cellular tissues and organs that have been transplanted from one person to another, either experimentally or for therapeutic purposes, are skin, kidney, heart, heart valves, liver, glandular tissue like pancreas transplant, bone marrow and lung, intestine, cornea, middle ear, bone and connective tissue. Skin transplantation. Skin graft surgery to help people who have damaged skin from burns, injuries, wounds, disease or infection. A skin graft may also be recommended after surgery to remove skin cancer. Most often, healthy skin from a person's own body, that is autograft, is used. Sometimes there is not enough healthy skin on a person's body to use for the procedure. If this happens, then skin from a cadaver, that is dead body, may be used, that is called allograft. Kidney transplantation. Conditions which may require a kidney transplant: kidney failure in diabetes, severe glomerulonephritis, that is, glomerulonephritis means damage to the tiny filters inside the kidneys, the glomeruli. It is often caused by the immune system attacking healthy body tissue. Severe pyelonephritis. Pyelonephritis occurs as a complication of a urinary tract infection that spreads from the bladder to the kidneys. Symptoms usually include fever, flank pain, nausea, vomiting, burning with urination, increased frequency, and urgency. Polycystic kidney disease. Polycystic kidney disease, PKD, is an inherited disorder in which clusters of cysts develop primarily within the kidneys, causing kidneys to enlarge and lose function over time. Cysts are non-cancerous round sacs containing fluid. The cysts vary in size and they can grow very large. Having many cysts or large cysts can damage the kidneys. Severe cases of hypertension leading to kidney failure. The procedure of kidney transplantation. During kidney transplant surgery, the donor kidney is placed inside the lower abdomen. Blood vessels of the new kidney are attached to major blood vessels in the lower part of the abdomen, just above one of the legs. The new kidney's urine tube, that is ureter, is connected to the bladder. With proper matching of tissues between persons, many kidney allografts have been successful for at least 5 to 15 years. Heart transplantation. A heart transplant may be considered in significant heart failure, where the heart is having trouble pumping enough blood around the body, usually the result of coronary heart disease, cardiomyopathy, or congenital heart disease. Coronary artery disease. It is caused by plaque buildup in the wall of the arteries that supply blood to the heart, called coronary arteries. Plaque is made up of cholesterol deposits. Plaque buildup causes the inside of the arteries to narrow over time. See ischemic heart disease in Medicine for Anyone in YouTube channel. Cardiomyopathy is a disease of the heart muscle that makes it harder for the heart to pump blood to the rest of the body. Cardiomyopathy can lead to heart failure. Procedure. The cardiac surgeon makes an incision in the chest, separates the chest bone, that is sternum, opens up the rib cage to operate on the heart. The deceased heart is removed and sews the donor heart into place, then attaches the major blood vessels to the donor heart. So, dear viewers, this is the end of part 1 of the 3-part series on transplantation in the Medicine for Anyone in the YouTube channel. Thank you for watching.